Lagos, it's 99.3 Nigeria Info, Nigeria's #1 talk news and sports radio station. Welcome to Maternity Line Show. I am Zaynab Yekeen, and of course, this is the show where we have conversations and proffering solutions to issues of maternal and child health in Nigeria. All right, so every Friday from 12:15 p.m. this show comes at you live on the station. We are located at 267A Etemian Crescent, Victoria Island. Yesterday, of course, we are continuing our conversation from last week, but of course with getting an expert opinion or expert insight on today's conversation. And the conversation is integrating TBAs into Nigeria's maternal health system, solution or risk? That is the question we are asking today. I will be joined, hopefully, by Comrade Chtistianah Adeboboye, Lagos State NANNM chairperson on that conversation. Currently, she's defending or working busy with a thesis, as she said last week, but she did give me a word that she should be able to still take calls, so she could join the conversation right from 12:30. But I'm due for a break right now. Right after my break, I do hope Comrade Chtistianah is able to join us on the show. And while we wait, right, because the plan is to have her from 12:30. While we wait, I would love for you, Lagos, to be a part of this conversation, just as you did last week. Remember, last week I did ask, should TBAs be strictly regulated, better integrated, or replaced? And you came correct. You came through. So we continue that conversation today, right after this break. Stay here, Lagos. Don't go away.
Nigeria Info. Let's talk.
Everyone says I'm beautiful and bold. They say I'm fashionable, and to crown it up, very confident. And my secret is...
People say I'm good looking, funny, hardworking, and to crown it up, very confident. And my secret is...
So whether in the office or at home,
in the streets or on the dance floor,
anytime, any day, I never lose my confidence. And the secret to my confidence is Wazobia perfume.
Absolutely. Wazobia perfume gives the authenticity and long-lasting fragrance all day. That's my secret confidence.
Wazobia perfume is available in body spray.
Also available in supermarkets and markets near you. Wazobia perfume, the correct scent.
This is Nigeria Info, where the conversation begins.
Do you think, as a scientist, we need GMOs in Nigeria?
Nigeria as a government has a policy that promotes the use of advanced biotechnology in ensuring food security, environmental conservation, and health improvement.
MDMA is there from the lab, from the containment level. Before it gets to the field, MDMA would have known that this crop will contaminate, and the regulatory agency, of course, will stop that before it gets to the Nigerian market.
Sylvia Musa, I'm sure you've seen that video, you've heard what she said. Is it satisfying what the AFN said?
You know, there is so much corruption in many aspects, in many sectors. We are in a country where the worst of us will be best of us.
Nigeria as a country is not ready for anything development, but Nigeria is
what do you mean?
Destruction.
Why? What do you mean by that?
Stay with us on 99.3 Nigeria Info.
To the first person who taught you how to read, the one who believed in you when no one else did, the one who showed you that you... Hey Lagos, think back to the first person who taught you how to read, the one who believed in you when no one else did, the one who showed you that you could be more. That person was a teacher. Every profession begins with a teacher. Doctors, lawyers, engineers, artists, leaders, all were shaped by teachers. Yet, too often, teachers are the unsung heroes of our society. Now, the time has come to change that. On Saturday, 20th of September 2025, 9 a.m. a.m. at Tafawa Balewa Square, Lagos. Over 60,000 teachers will gather for the very first time in the world in a historic Guinness World Record attempt. And guess what? Attendance is absolutely free. This is more than an event. It's a movement to celebrate teachers, to honor their sacrifice, and to declare to the world, teachers matter. Don't just hear about it, be there, be counted, be celebrated. Join us at the Let There Be Teachers Conference 2025. Visit www.1millionteachers.com. That is www.1millionteachers.com or call 006 608 3168 006 608 3168 for more information, because teachers don't just teach, they change destinies.
Be a part of conversations that affect you, mothers, as well as your child, on Maternity Line Show, where Zaynab unearths motherhood through unique stories in reproductive health.
Pregnancy is quite challenging for me. For the first pregnancy, I had to deliver at 32 weeks.
I hit my tummy on the COVID and immediately I was rushed to the hospital.
How about asking questions that benefit your child, babies, and toddlers?
Immunization for children has a lot of benefits. You vaccinate your child till the 15th month. Most parents stop at 6 months when their babies stop breastfeeding.
On the show that features experts and professionals across maternal and child health. Join Zaynab as she amplifies voices of women for better physical, mental, and social well-being. We discuss parenting.
My kid is a bit older now. When he was younger, it was a bit more stressful, but now we kind of work with each other.
My name is Ugo. Thank you for bringing up this topic. So I'm a single mother.
And even hand the mic over to allies who are men and fathers, creating better outcome for child and maternal practices. Join Zaynab Fridays 12:15 p.m. on 99.3 Nigeria Info on Maternity Line Show, an all-encompassing medium for every woman, mothers and intending mothers.
The ones that are quacks are the ones that deceive the public, and then they provide services that they are not trained for, illegally. They provide orthodox, which is medical services that they are not trained for in any recognized institution. They unfortunately kill people. They are the ones that cause a lot of people, what we call puerperal sepsis after delivery, that sometimes cause mental illness, what we call puerperal psychosis in medical terms. And it can even cause death. They are the ones that, these people are the ones that carry out illegal abortions. And the abortions usually, most of the time, is not complete. And once it's not complete, it causes a lot of sepsis. In fact, that is even more devastating than any other cause of sepsis. That's a major cause of sepsis that actually go into, killing the either the pregnant teenager or the pregnant woman, because they use all sorts of unsterilized instruments. They are not trained for what they do. They don't know how to use most of this equipment, and their victims, unfortunately, do not know that they are not even qualified to carry out all that they do. We have quite a number of examples that that come to us, and we try to save their life. And some are fortunate to make it. A lot are not fortunate like that, and because it also depends on the level in which you are presenting as well.
All right, Lagos, that was the voice of Dr. Folashade Oludara, Director of Family Health and Nutrition for the Lagos State Ministry of Health. She has been leading efforts to standardize and improve the practices of traditional birth attendance in Lagos. Okay, and of course, she was my guest on the show a couple of weeks back. Yes, we're hoping she's back with us next week on the show, and we needed to lay that background. That was why I played her voice one more time. Last week on the show, remember, I did bring to your notice or to your attention, and then we also which also sparked a lot of debate, of course, from you, my darling maternity liners. So today, be a part of this conversation again, as I am hoping. I'm checking right now. Okay. Comrade Chtistianah, are you there? Okay, I'll keep checking. She told me it's maybe like this, but she's passionate, quoting her right now, that she's passionate about wanting to be a part of this conversation today because she has been preaching. She calls it, she has been preaching against it. And of course, areas where education is needed as well. She's been talking about it. We had a very lengthy discussion yesterday. I think that was 19 plus 7 minutes kind of conversation, about 26 minutes conversation on the telephone. And guess what? WhatsApp broke my heart. I sought her consent as to whether the conversation could be recorded so as to play for you today on the show. Unfortunately, when I got to the office and I was trying to expunge that, I realized that the sound was actually displaying, and I couldn't hear anything. Then I ran to my digital team, and the guys made me understand that sadly, WhatsApp respects privacy, or privacy, you may want to call it. And this was why it wasn't playing out, despite seeking the consent of my guest that I will be playing this conversation today, because I asked a lot of questions. Sadly, I just hope she's able to join us on the show as promised. I understand, by the way. Okay, so Lagos, to be a part of this conversation, Grandma Omolara, my sincerest apologies. You were trying to call into the show last week and we held down your call. Not unknowingly, yes, I was in conversation with a couple of other callers at the time, so this might be another time for you, the right time to be a part of this conversation. If you are listening to us right now to Nigeria Info 99.3, so the question I am meant to be putting to my guest today is, if Nigeria's health system integrates traditional birth attendant into its maternal health system, will it be a great solution or a risk? So hopefully, as I keep saying, she's able to join us. But while at it, Lagos, this is a conversation for you, okay? With Nigeria facing a maternal health crisis, should traditional birth attendants be seen as part of the solution or part of the problem? Last week, we discussed the TBAs, and I asked, should TBAs be strictly regulated, better integrated, or replaced? Amina, of course, a first-time caller who sadly lost her 3-month pregnancy last year, shared her miscarriage experience. And according to her, she said they should be eradicated. Some of them should be eradicated, in her words. Listen to this, Lagos.
This is my first time. To me, some of them should be eradicated because so many people have been losing their lives due to some that doesn't undergo the training very well, and some the children, rather for them to go to the hospital, they rather go to the cheaper place. And they don't know how to do their work very well.
Have you ever had any previous experience with traditional birth attendants?
Yes, I have.
Oh.
Because, like last year, I lost a 3-month pregnancy due to this hospital, but it's not standard. So I went there. I was having stomach pain. I went there for checkup because to reach to the town, so I can get it, the pain was much for me. So I went to the closer one. So when I went there, and then I checked me as that I should go back, and nothing is wrong. I should just rest. throughout that night, I couldn't sleep. Then I had a miscarriage. They had to rush me to the hospital. My was washed. So that was my reason of saying that.
I am so sorry about your experience, Amina. But Amina, right from the period you conceived, why didn't you go to a government facility within Ikorodu over there?
No, I just came to Ikorodu last week. I'm a Kogi girl.
Oh, okay. So this experience you are sharing happened in Kogi?
Yes, that was
last year. I'm deeply sorry about your experience. I pray that God gives you another child that stays with you forever. All right?
Amen. Thank
All right, that was Amina's voice. She called into the show last week, and that's this week, I believe, makes it 2 weeks that she just got to Lagos. As of last week, she said last week. So while we hope that the National Association of Nigerian Nurses and Midwife chairperson joins us, I'd love to hear from you, Lagos. I do have a message already on WhatsApp, but before I do that, let me check on my guest. Okay, this has been the feedback I am getting. Okay, so Lagos, I have this one from Babatunde Afolami. Babatunde Afolami says, Good afternoon, Zaynab. Good afternoon, Zaynab. I was trying to call into your show last week, but you did not pick my call. Afalami, that wasn't my fault. You could try again. I've been calling the number 02012770. That's for the female. 0201465790. Afalami, that's the general line for you to call into the show. WhatsApp is 0809-5975-805 for those who are listening and would love to forward in their message like Babatunde Afolami. Okay, so he goes further to say, the havoc that these people are causing us as a country is disheartening. Can this ever happen in international climes? Oh well, Babatunde Afolami, thank you so much for your message. You may want to call in now that you have the number 0201-277-0993, 0201-465-7190. Last week on the show, I remember saying that earlier in the year, Lagos State government did set up a committee to regulate traditional birth attendance practices, and that committee consists of a 15-member to regulate the practices of traditional birth attendance towards improving maternal and child health outcomes. And now let me read the statement from by the Ministry of Health. Yes, according to a statement by the ministry, they convened a high-level stakeholders meeting at the time to deliberate on regulating TBAs activities focused on standardizing TBA training, defining their scope of operations, ensuring compliance with health regulations, and establishing an effective patient referral system. Now, here is me quoting, in a bid to improve maternal and child health outcomes, the Lagos State Ministry of Health convened a high-level stakeholders meeting focused on regulating activities of TBAs in the state. The meeting brought together key policymakers, health professionals, and regulatory bodies to deliberate on strategies for ensuring TBAs operate within established guidelines and contribute effectively to safe childbirth practices. Okay, now let me tell you why that committee was formed. Okay, there have been concerns raised over maternal and neonatal complications linked to unregulated TB practices. Now, according to Professor Abayomi at the time, the need to oversight to ensure TBAs contribute positively to maternal health care. He says we must ensure that every childbirth service, whether in hospitals or through TBAs, adheres to safety standards. That same statement also had Dr. Kemi Ogunyemi, the special advisor to the governor on health, who was once on the show talking as well. So now you need to listen to warning when using TBA as given by Dr. Folashade Oludara. Here is it. Have a listen.
You see, when you are pregnant, you have the responsibility of registering at a qualified or registered for antenatal at a registered health facility. So I know quite a number also believe in traditional means, but make sure, even if you are going to traditional means, make sure you go to registered traditional facility, because we have quite a number of people there, camouflaging as, traditional practitioners, whereas they practice quackery. They mix both tradition and orthodox. In fact, a lot of them do not even practice traditional means, because whoever is practicing traditional means should not even, mix whatever he or she is using with orthodox medicine at all. So you use all traditional means. And even for that, because the government has the traditional medicine board that actually regulates those people. So those genuine traditional practitioners, they have no fear of coming out and registering with a traditional board of traditional medicine.
This is
Maternity Line.
Okay, Lagos, we are back. I am Zaynab Yekeen, and this is Maternity Line Show. I'm getting a message, from Ola. Please make your station clearer at Ikeja GRA. We are doing our best, but we keep getting reports of interference from other stations. We're on it. Trust us. Good afternoon. This caller isn't ready. Good afternoon. Hello. What's going on with our telephone lines? Good afternoon. Okay. All right. So keep trying. 020127709993, 0201465790. Drop me your message on WhatsApp. We're supposed to have a guest. Of course, if she cannot join us again as promised earlier, that's the chairperson of NANNM. Good afternoon.
Good afternoon, Zane. How are you?
I'm very well, thank you. Grandma Kenny.
Yes. Good show. I know that some indigent women are intimidated by regular Orthodox, healthcare facilities. So in order to cater to them, I would say we shouldn't abolish the TBA, facilities as, specified and advocated for by the experts in the field. I stand firmly behind them in terms of adequate regulation and they being attached to, a veritable medical facility for escalating situations. As I said last week,
that's right.
What I would want to see is that at the first instance of any complications, these young people, these pregnant women, should be immediately transferred to a veritable medical facility to handle their case. My thought also is, if there be any infraction whatsoever, no matter how minor it is, that TBA facility should be shut down, so that it will prevent any adverse consequence on other mothers. I think this will go a long way to reduce maternal mortality. Nigeria should continue what we're doing. We should cater to our indigent people with love. The ambulances should be there, ready to transport them, like in Lagos State, where we now have Okada ambulances. You heard about it, right?
Okada ambulances, yes.
Yes, yeah. So and I know that I expect that most of these TBAs should be in outlier locations. If they're in Lagos, then I'll be surprised. But wherever they are located, there should be ambulances attached to them that have fuel in the ambulances, drivers ready to transport our precious pregnant mothers to a veritable orthodox facility when need be. Continue the good work you're doing. I really appreciate you.
Thank you so much. I appreciate your call too, Grandma Kenny. So for those who may be wondering, Okada ambulance that she mentioned, actually Lagos has specialized motorcycle ambulances known as ambulance Okada, which is to navigate traffic and provide quicker emergency care, so by reaching difficult to access areas. Okay, so and I agree, yes, with Grandma Kenny. I mean, in situation where there are emergency situations in the area of maternal and child health, MCH, or at the point of birth, for those especially, maybe not only them, but I feel like this aligns a lot so well with such idea, having them on standby. If you choose TBAs, especially the registered ones, because the registered ones will be properly and rightly checked by the Lagos State government, as also stated by Dr. Folashade Oludara in my previous soundbite I played, right? So if you choose them, things will be done the appropriate, proper way. So in during emergency situation, things like this could also come in so as to convey a mother in such a situation. All right, so I forgot to tell you the other time that the committee and their mandate, that's the 15-member committee by the Lagos State government, in ensuring that the activities of the TBAs are checked. They include representatives from the Lagos State Ministry of Health, the Society of Gynecology and Obstetrics of Nigeria, that's SOGON, the Pediatric Association of Nigeria, PAN, also the Lagos Traditional Medicine Board, LSTMB, the National Association of Nigerian Nurses and Midwives, that's NANNM, of which we were also have been joined by the chairperson. Also the Lagos State Blood Transfusion Service, LSBTS, and the World Health Organization. And the mandates include assessing the challenges associated with TBA practices, recommending regulatory measures, submitting a comprehensive report for evaluation by a larger stakeholder assembly. So it's a lot, because the ministry understand that there is the need to equip TBAs with the right skills and knowledge to ensure safe deliveries. Okay, so this is the right move in the right direction. Well done, Lagos State government, on that one. So again, if you'd love to be a part of this conversation, this numbers to call 0201 277 0993, 0201 465 7190, 5975805 is the WhatsApp line. I'm due for another break in less than 2 minutes, but I'm checking my messages on WhatsApp now. I have this one from Oluwakemi Gbadamosi from House and Right. Oh, I think I'm beginning to have more listeners from House and Right Estate. Ojota. Okay, Oluwakemi Kemi Gbadamosi, thank you so much for your message. She goes to say, good afternoon. Well done, Zaynab. I feel like this your show has a lot to deliver with very limited time on the show. Let's see. Okay, see what? Look, I came with Adamosi. Do you want to sponsor the show? I'll be very, 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 very appreciative of that. Oh, okay. Let's see. You concluded. Thank you for your message. I do appreciate it. I really and truly appreciate. Good afternoon, Nigeria Info.
Hello, good afternoon.
Good afternoon. This is 99.3.
Well done.
Thank you.
Yeah, my name is Bolaji from Ijoku.
All right, Mr. Bolaji, go ahead.
Yeah, I love the topic you've just brought. In fact, I'm a good listener of your station, but I've not listened to this program before.
Maternity line.
So thank God I get you this afternoon. The first thing, before we will go to this kind of conversation, I think there are some conversations that are supposed to precede it. Like where they in Ogun State now. I have not studied their NHS, so I really wanted to key in, but I have not really seen it.
But we are not discussing health insurance scheme. We did that in the past weeks. Perhaps.
No, I'm coming.
Okay.
I'm coming. I'm going to. You are discussing.
Please go. Just go ahead. Go ahead. The traditional birth attendants.
Now the problem is that our health sector is starting some of this problem for some of this issue. You see somebody who is supposed to go to government hospital. The bills there will start him first. So, and other thing is that when you go to government hospitals, even the one that are having whatever the insurance,
health, yes.
Thank you. They will not be able to take care of some certain ailments. They will say, no, this one is not about this one. No, before they toss that person around.
Oh my, that was you, not from me. Yes. Sorry about that. Anyway, Lagos, we're still very much on the show. I was trying to link what he was saying. I was trying to make a sense of it. I think he was trying to say if many are on the National Health Insurance Scheme, it would be easier for them it would be easier for them to go to the public facilities, or even maybe private, once they are able to, if they are enrolled on HMO or NHIS, yes, which is health insurance scheme. I was trying to make a sense of that. But however, if you're also trying to understand that traditional birth attendants, these are individuals who assist pregnant women during childbirth. Often they are in rural and underserved communities where access to modern health care is limited. All right. And these people provide prenatal, they provide delivery, they provide a postnatal care, sort of relying on traditional methods, herbal medicines and cultural practices. We've had discussions in all of these areas. Okay. Also, some also offer maternal nutrition guidance, newborn care, and family planning services. And in spite of their role, despite their role in supporting maternal health, these people also have challenges they face because they lack formal obstetric training, and they think they are helping. I just lost the call again. Anyway, okay, I think the person is calling back. Please, when you call in, just make it short and snappy. Thank you. I'm with you.
Good afternoon.
Good afternoon. Your radio is on. You have to put it off.
Hello, are you okay now?
Are you okay too?
Yeah, I'm okay.
Fantastic. Now, go on.
You see, the problem is that a lot of time.
Snappy, just a minute, please.
Yeah, yes. Hello?
I'm with you. Please go ahead.
Okay. A lot of times, you see this public maternity, government-owned maternity and hospital. They condemn this indigent or not so rich people that approach them to CS. They say, oh, it's difficult. Let's do CS. And it happened in my family, and we take solace in traditional, and the child was delivered.
Okay.
You see, but most of the time, I don't know whether it's laziness or they are not equipped enough. You see, they say, they condemn people to go and, yes, you are going to do CSO.
Well, I understand you're trying to make a very valid point, but at the same time, you were also, I think, condemning it. I don't know. But yes, I get you. You made use of the TBAs, and then I think you were the same person who called earlier on. Anyway, I was going to say this before his call came in, that despite the role of TBAs in supporting maternal health, right? Part of the challenges they face is formal obstetric training, because they don't 100% have that training, which sort of increases the risk of birth complications, infections, even like sepsis, and also maternal or neonatal mortality. This is why we have been running the series maternal mortality prevention. Okay, we've discussed sepsis, we've discussed hemorrhage, we've discussed what else, preeclampsia, but we have a couple more to go, and we are going to be touching on all of them. I think another challenge these people have is limited access to emergency medical care and life-saving interventions, to which all put together exacerbates the risks that we are talking about. Let's see in subsequent episodes if we are able to get NANNM chairperson to join us again, Mrs. Comr Adeboboye, also director at the Lagos State Ministry of Health, Child and Nutrition, Maternal Health, Dr. Folashade Oludara. Sincerely, I appreciate each and every one of you who called into the show and those who dropped me message. I'll be reading my last message before the news comes in. Bolu Atife, we are here waiting for you. So I have this one from Rachel. Rachel is messaging from Keto. Rachel says, good afternoon, Zaynab. I love that we talk about this again. Of course, we'll talk about it. Thank you so much, Rachel, particularly because we couldn't have any guests to join us today to educate us further on this conversation. Lagos, thank you so much. It's time for the 1 o'clock news, and right after that, Danfo Conversation comes in at 3 p.m. At 2:30, we have Dr. Fred on Health and Safety Cafe. And at 3 p.m., we have Mary Ann Jukokon on Hard Fact. At 4 p.m., it's Borderlines with Cecile of Lagos. You might want to stick around for that. Don't go anywhere, Lagos.
99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's